With an estimated 1 in 17 people in the UK suffering from diabetes and numbers set to grow, it's vital that clinicians spot the signs early. Hitachi is developing a new web-based programme allowing people to find out if they are at risk of developing the condition. Sharon Thomas has more.
There are 3.2 million people in the UK with type 2 diabetes, with more diagnosed each year. Treating the condition costs the NHS nearly £9 billion a year. That's 9% of its budget. Complications that arise from type 2 diabetes cost a further £13 billion. The government is facing a shortfall in funding and needs to look at preventative measures. It's a vast amount of money being spent managing a condition and its implications that in many cases could be avoided with early and correct intervention. Here in Salford, 1 in 10 men over the age of 60 have diabetes. They're about to implement a new enhanced care pathway here, which aims to proactively identify those at risk of diabetes via early diagnosis and a more preventative approach.
Diabetes, very expensive from a patient point of view and health service point of view. If we can prevent it, we save lots of ill health from the patient's perspective, we save lots of cost from the health service perspective. We think we can do that. We've been working on that for a few years now. We can do it remotely using a contact centre based approach over the telephone. People like that, but it could be more efficient, it could be more effective. And that's what we're working on with Hitachi.
Now then, I see from the notes that practice nurses put on that last time she checked your blood pressure, it was a little bit raised.
GP surgeries are often the first port of call for early diagnosis. A new high-tech initiative run in conjunction with Hitachi involves a programme which identifies risk and focuses on prevention. It also empowers the patient to take control of their own symptoms and act on the results. Based on the outcome of key indicators, a patient could then be referred to a specialist diabetes team across the city.
I think it's extremely important to diagnose diabetes early and also to pick up people who are at high risk of developing diabetes later on. Once you have diabetes, diabetes in itself is a major cause of stroke, kidney failure and lower limb amputation. It's one of the major causes of blindness in people of working age. And I think sometimes people just don't realise what a significant diagnosis diabetes is and what impact it can have on their future health. So if you can pick them up early and hopefully prevent them actually getting diabetes, that's a really important thing for everyone.
Community Diabetes Team, Amy speaking.
A specialist diabetes team currently runs a phone-based operation for patients. Here they're keen to leverage technology which will provide access for more patients and subsequently greater prevention. By the time patients are referred here, they've decided to take control and be part of the programme that will help them manage their condition.
It's a fantastic opportunity to work with Hitachi, who have the technology and the experience to facilitate people's ability to access programmes on the palm of their hand, on their tablets, at home, in their lounges, and be able to put information into a system that we can see here.
12,000 people in Salford have diabetes. The onset and impact can be devastating. It's vital that technology is harnessed to help minimise that.
Hitachi's focus is on social innovation and bringing new innovative technologies to the forefront. Coming to Manchester really provided an opportunity to improve healthcare, very focused on diabetes and prevention, and improve the healthcare of the citizens within Manchester.
It's estimated that more than 630,000 people in the UK have type 2 diabetes and don't know it. Helping them manage that condition effectively is the key to saving money and saving lives.